I am delighted today to introduce to you Dr. Eric Doc Griggs, who is a New Orleans-based community medicine MD and health educator. He has dedicated his professional life to raising health and wellness awareness in communities across the country. In addition to being recently appointed to assistant professor at LSU School of Medicine and director of community medicine at Access Health Louisiana, Dr. Griggs proudly serves as the founder and executive director of the Duckworth Foundation. Doc is an active participant in several organizations that promote positive change in communities. He is the Health and Wellness Chair for 100 Black Men of Metro New Orleans, and he serves on the 100 Black Men International Health and Wellness Committee. In March 2014, Dr. Griggs was named spokesperson for the American Cancer Society in the Greater New Orleans area and is a member of their Executive Leadership Council. Doc is currently a member of the American Heart Association's Greater Southeast Affiliate Multicultural Initiatives Committee, which is a mouthful, and was formerly chair for the association's Multicultural Leadership Committee. Please join me in welcoming Dr. Griggs to Tulane.
Thank you. I can step from behind this lectern. Good afternoon. My name is Dr. Eric Griggs, and I am the Director of Community Medicine for Access Health Louisiana. And the first question everyone asks is, what is community medicine? Does anyone know? Anyone? Anyone in between your roly-poly wrap? Anyone? Can anyone tell me? Anyone have any idea? Okay, so I graduated from Tulane Med School in 1996. Decided that I wasn't sure what I wanted to do, so I ended up completing a transitional residency in the Department of Community Medicine. Community medicine is 3 P's. It's people, it's practice, and it's policy. I just got off a radio show. In addition to the other things that I do, I'm a health educator for Fox 8 News on Wednesdays and Thursdays. And I have radio shows, about 3 radio shows, with WHIV, iHeartMedia, and WBOK. Needless to say, I talk a lot. After I finished my residency, I didn't know really what I wanted to do, so I started doing a lot of clinical research. I did that for about 12 years and started realizing that as this animal called medicine had changed, so had the quote-unquote practice of medicine, and the art of medicine had disappeared to the point I didn't want anything to do with it. In med school, the average doctor visit for a new student was about an hour and a half. For a new patient for a practicing physician was about an hour. The average doctor these days spends 12 minutes with their patients, 4 actual minutes of interaction, and a lot of times 0 touches. The studies show that for every 1 time I touch, not only is your patient satisfaction up, but that touch is the equivalent in a patient's mind of 15 minutes. As we've gone further and further, we're getting to the point of AI technology. Has anybody ever heard of Mabu? Anybody? Mabu, M-A-B-U. It's in its pilot phase with Kaiser Permanente in California. It's an artificial intelligence robot that you take home, and it just talks to you like Siri or Alexa. It gets to know your personality. And every, whatever time period is programmed into it, it'll scan your vitals. And it'll ask, have you drank water? Have you taken your pills? And it'll talk to you to the point that in the article, that this senior that's participating in the trial said he's going to be sad when the trial is over because he feels like he's losing a friend. That's where we're going at with technology. We're taking ourselves out of something that we created to take care of ourselves. And the studies are showing that it can't function without people. Where I'm going with this is, the reason everyone asks, well, doctor, do you see patients? No. Did you ever? Short period of time. Why did you stop? As a matter of fact, I recently had to go before the board because they were asking me, Doc, what are you doing? Are you practicing? No, I'm not. What are you doing? I'm doing community education. When I was in residency, I saw patients. I would see 30 to 40 patients a day. Now, between television, radio, and these public appearances, I do about 350 to 500,000 people a week. Which is the bigger wand? The problem with the system is that as we've gotten, we're all in a good school. I graduated from Notre Dame and Tulane. So Our problem that we're running into in healthcare isn't that we're not well educated, because we're very well educated, right? Y'all paying all this money, y'all don't think you're in a good school? We're very well educated. But the problem is that we're too freaking smart. So here I am, third year, fourth year med student. I was an intern, my intern year. I caught the flu. I'm shivering, and I'm shaking. They're sending me home. Actually, they sent me to the call room until they realized I was going to infect the call room. So I got the attending, the resident, all my friends are doctors and students, and I'm shivering and I'm shaking. And the first person I called when I picked up the phone was my mom ain't no doctor. I called my mom and my grandma. Mom, I think I'm going to die. Well, baby, where you at? I'm in the hospital. You in the hospital sick? No. Well, why don't you ask one of your doctors what to do? They don't know what to do. They got big words. I'm sick. Well, lay down, eat some soup, drink some water, get some rest, and go home. And most importantly, and people know I say this on television a lot, keep your hands and your bugs to yourself. Has that changed? No. That's the gap. The families and the people that love and appreciate us and exalt us, to send us to these schools, to come back and be proud and take care of them, we've become too smart to talk to them. We become too smart to include them in the solution. If I were to go to my hometown, speaking Hungarian, to a group of 6-year-olds that are trying to play soccer, and I could be the most brilliant soccer coach in the world, but I don't speak to these 6-year-olds in a language they understand, am I effective? Am I any good? You're only as good in this society as your successes, right? Right? Wrong? So if an article in USA Today states that based on Journal of American Medicine Cardiology and based on the CDC records, that we are actually at a stalemate, at a standstill when it comes to progression against heart disease, to the point that we're almost about to start regressing, largely due to diabetes and obesity. Are we winning? Are we winning? No. The system's broken. And the answer isn't with us, the smart people. If there's a problem with health, when I say health literacy, who's the teacher in the health literacy equation? I'm very active. I'll remember everybody's name, start calling you out, and give you that cortisol effect. Who is the teacher in the health literacy equation? The doctor or the community? Anybody ask you? You think so? Who's the teacher? The problem is that when we're dealing with communities, we know too much of what they need. And we talk to them about what they need. In order to be effective in a community, I need to come in here to this community here. First of all, I'm like, okay, what do you want me to talk about? And whether or not I know what I need, y'all need to know, listen, how to get out of here and get a rebate on your financial aid before you get out, on your road, the whole nine. But even though I know you need that, if that's not what you want to hear me say, are you going to pay me any attention? So we're not talking in a language they understand. We're not listening. So how do you expect to win? How many people in here know what high blood pressure is? Hypertension. What's hypertension? Anybody know what hypertension is? All these students reading all these books. Y'all better know what hypertension is. Somebody better know something. What's hypertension? So what you're experiencing right now is a cortisol effect. There are 2 stress hormones that take place in the cortisol effect. One to keep your blood sugar up, one to keep your blood pressure up. Cortisol is the one to keep your blood sugar up, but it also causes the deer in headlight effect. I watch your pupil and she goes,
I'm also chewing.
and she's chewing. This is the cortisol effect. Once we get past it, what's hypertension?
Hypertension is when
There's no wrong answer. Come on, okay. She started with the blood pressure. Yeah, what's hypertension?
I would say chronic high blood pressure.
Chronic high blood pressure. Okay, what's high blood pressure? Lamar, I'm not calling on you on purpose. What's high blood pressure? Yeah. What's blood pressure? In the back. What's blood pressure? Looking away from me because I won't call on you. What's blood pressure?
Oh, I'm fat. I'm not a student.
What's blood pressure? Even better. What's high blood pressure? What's blood pressure? There's no wrong answer. There's no wrong answer.
It's the way the pressure of the blood flowing in your body.
Pressure of the blood flowing through your body. So, part of the reason that I've been asked, and I'll tell you how I fell into this a while back, that I've been asked and been somewhat effective, is that I have a sister that's 14 years younger than I am. So when I would call home in med school, she was in 2nd grade, and I'd call her Stick. I'm like, hey, Stick, what you doing in school today? I learned long division. Tell me about what's long division. You know, that's when the times and the 3 goes into the 9 3 times. Oh, long division, good. And she would turn around. What did you learn today in school? I learned about glycolysis. What's that? Well, you know, it's how it breaks down glucose. What's that? Well, that's sugar. Why didn't you say that? You learn to break things down. The problem in the community is that we're talking over our heads. We do a lot of word identification. A lot of people think they know what hypertension is, right? Because we hear it all the time. Oh, I have hypertension, and I'll take hydrochlorothiazide, and blah, 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 blah. Vivid example. I'm very active. My platform is get checked, get fit, get moving. Health, food, exercise. Get checked, get fit, get moving. So what I'd like you to do is stand up. I want you to take your right hand and wave at me. Repeat after me. Your blood.
Blood.
All right, sweet. Blood. Pressure. Is the pressure when your heart squeezes down over when it relaxes. The top number is called systole. The bottom number is called diastole. Normal blood pressure is 120 over 80. So let's see how much you remember. Your blood. Thanks, Doc.
That wasn't all right.
Is the pressure on your heart. I ain't saying no contract. Squeezes down. Over when it. The top number should be. Pressure should be. And it's called. Systole, systolic, whatever. The bottom number should be. And it's called. So do you think a patient, you can sit down. Do you think a patient would take that home with them? So when they're coming to the doctor and you're telling them you have high blood pressure, you mean your blood pressure is 160? That means my heart is squeezing down that hard? Mm-hmm. Over 110? You mean that means my heart's not relaxing that much? Does that make sense? I don't know. Y'all are eating. Does it make sense? Or does it sound too simplistic? It sounds really simplistic. If you can't explain it to a 4-year-old, then you can't explain it. For every 3 minutes that I spend on my segments, and I've been doing it for 6 years now on at Fox, I spend at least 2 to 3 hours reading because I don't know where they're going to take me, and I have to read the latest studies because someone's always going to try to trip you up. And the problem that you run into is the problem of any professional. The job of a professional is to do the work and do it so many times that it looks easy. The problem is it looks easy. And because it's easy and you can explain it in simple terms, people underestimate you. Case in point. Part of the reason that I decided I did not want to practice traditional medicine is because I have a close family member with a mental illness that was diagnosed in 1987, 88, right before I went to college. Didn't know what to do. It was new to me. When I was in med school, she would call into the OR suites and would cuss me out over the air while I'm trying to do what it is that I'm doing. In college, when we had, y'all don't even know, when we had these things called answering machines that you would wait for the beep and we'd make these cute, put rap songs on them. Yeah, look, call me back, yeah. My mother would call, at one point it was 107 times in an hour and leave long, these diatribes. I went through the progression of the antipsychotics and all of the psychiatric meds with her condition. Tried to honor all of my psychiatric courses, got through, and still couldn't fix it. I would spend, my classmates ended up getting an award in med school because I was very quiet about it. Robert Baird Award for Overachievement to attain a medical degree. And I didn't know what they gave it to me for because I was just doing what I needed to do. But I'd be going back and forth on the weekends to meet with my mom's doctors so she wouldn't be institutionalized for the rest of her life. And my sister wouldn't be put in a foster home. So I'm faking the funk. These parent-teacher conferences can't drive because I just got off work. And I'd have to rush back, reschedule some of my tests to get through it. That was strike one. If I couldn't help my mother, if I couldn't help my family, why am I doing this? And then they had started this thing. I'll never forget, there was a kid. I didn't believe ADHD was real. She was 2 years old. Literally, we removed all stimuli from the room. We were at the St. Thomas Clinic, and she started playing with the lines on the floor. And we'd go from one line to the next line to the next line. And I'm standing there with the grandmother and my attendant, and the nurse knocks on the door. Doc, you've been in here long enough. We got to go to the next patient. How are you supposed to assess what's wrong with this baby? If you can't talk to her, you have to observe her. I'm sorry, we got to move on. Strike two. Strike three. I'm done, completed the transitional residency. I'm working my lab rats, trying not to kill them, doing all this stuff. They want to bite you and do all that stuff. I get a call to come home because I was raising my grandparents. My grandmother, sorry. My grandmother says my grandfather did this thing called hospice. Did the community medicine rotation when it first started. Might have been a sentence or whatever. I'm from North Carolina, y'all. So when my grandmother said hospice, I thought she was saying hospital. So I'm like, all right, I'm going to the hospital. Emergently fly home. My uncle drives right by the hospital. We go to this one-story, nice facility of buildings, and I see all these patients. I'm like, what is this? What's going on? I have 13 of my family members in the room. Call me Rabbit. He was laying there doing the agonal breathing. My grandmother said, Spurgeon, Rabbit's here. He opened his eyes. I went over to the side of the bed, and I grabbed his hand, and there's a handshake that they taught us back then, where I'd shake your hand, and I'd put my finger on your radial artery. And there's some people, some doctors are so good they can tell your blood pressure, but I could feel his heartbeat on the tip of my finger. Well, I shake his hand, and he made two small creases. Like he turned his head to say something, and he went, and I watched, and I heard, and I saw. And what they trained us to do is that if you witness the last breath of a patient, you're to do a precordial thump to restart it like a TV. I reared back to do the precordial thump in front of my grandmother, my mother, my sister, 13 of my family members, and a nurse literally ran out from the hallway into the room and restrained me and said, I'm sorry, Doc, this is a hospice. And I said, ma'am, I don't know what you call it, and I was about to play football in college. She was about to feel all of it. And my grandmother said, Eric, you better not let him go. So I'm standing there like this in front of my entire family that sent me to med school, and I have to let him go. I don't want to do it. I was done. Absolutely done. Done. At that moment. It was one of the toughest moments, and I don't talk about that much. That was one of the toughest moments. Toughest moments, just to get through. So I faked the funk for years. Oh, do you want to do it? Oh, yeah, I'm going to do this, that, and the other. I finally decided I'm not going to do it, and I told my family, which was tough, because I was the pride and joy of my family, but now I was a village idiot. And African Americans make up 4% of all physicians in the entire country. 4%. African American males make up 35% of that 4%. About 17,000 African Americans, 17, 20, not even 20, because there's only 40,000, about 17% of African American male doctors in the country. Now, I work with a group called STEM NOLA, and we've done 30,000 kids in the community. We put them in white coats. We dissect sheep hearts. We do lungs. I'm going to teach y'all the heart dance in a little bit. We do all that stuff. Because what kids see is what they want to be. I wanted to be Superman, Batman. I wanted to be a football player, a basketball player. I wanted to be on the news. No, I didn't want to be on the news. My mom was on the news. And I have a fear of public speaking. And the people that know me know I get nervous every time. I'm nervous now. The difference is when I public speak and I get nervous, I smile. And I can hear my grandmother now telling me, what kind of fool just down there smiling, making me shame? Because when I would speak at church, I'd be smiling. She's sitting in church like that. And I knew I'd get it when I got down until people said I did a decent job. But the problem is, if they don't see me, how can they know to be me? We're at an event in STEM NOAA. Like I said, we've done 30,000 kids in 6 years, not just in medicine with hearts and lungs, but we take STEM to the community, right? We were in the cutoff last year. This guy was about mid-30s, African-American male from Mississippi, walks up to me and says, man, I just want to shake your hand. You're the first black male doctor I've ever seen.
Is it split?
I told him, lucky you, because I hate doctors. Thank you.
Yeah.
My point is, I'd walked away. So I decided I wanted to go to law school. And then one day, I guess when you're called to do something, you're called to do it. I was a village idiot in my family. They couldn't wait to talk because apparently I was setting a bar that I didn't know I was setting for other people in school, sports, the whole nine. My friend of mine called me to go to lunch with him. He had a radio show on WBOK. And I'm like, dude, I'll go on there with you as long as you don't call me doctor. It had gotten to the point where I wouldn't tell him, what did you do? I majored in science. What are you doing right now? I do research, and I'm going to law school. So you're a doctor? Nah, I'm not. I didn't want anything to do with it. So we go on this radio show, and we're talking about, I had a med spa at the time. I owned a family practice. I'm doing whatever it'll take for my family to be proud of me, and it just didn't work. My dad already died, disappointed in me. So we're playing on the phone. He said, we got Dr. Griggs on the radio, and literally on the air. I'm kicking him under the table. Stop calling me that. And we're going back and forth. This elderly lady called and said, I don't know if you're playing on the air, baby, but I really have a question. Can you explain to me why my doctor keeps saying that I'm going to die of a stroke? I'm like, well, what do you mean? Well, he said I got the tension. I'm like, you have the tension. Well, tell me about your tension. Well, every morning, I wake up in the morning. Come on, docs. It's that simple. I wake up in the morning. I drink my coffee. I catch the headache. My headache goes away. I wake up in the morning when the blood pressure is highest. I drink my coffee. It raises it up. I catch the headache, and my headache goes away. I said, what's your blood pressure, ma'am? It's usually about 160 over 120, 100 something. But look, it's been like that. My blood pressure always like that. It's been like that for like 20 years. I don't know why you're fussing now. I got this new doctor. He don't know what he's talking about. I said, well, ma'am. She said, are you a doctor or not? I said, I don't know, but right now I know you're going to have a stroke. she said that, listen, well, you sound like that fool doctor if you're going to tell me to stop drinking my coffee. I said, ma'am, I'm not going to tell you to stop drinking your coffee, but what I can tell you is that tension is called high blood pressure, and it's a painless disease. That's why it kills. If you're having a headache to the point that you notice it every morning, your blood pressure is shooting up to the point that I said, if you can imagine a hose, and you squeeze down on the pipe, and you try to water a flower, what's going to happen to it? Oh, no, baby, what kind of fool would do that? Only a fool would do that. What's happening, Seven? I like calling people out because I used to always be late. That's why I'm a good friend. What kind of fool would want to water a flower and squeeze down on it? I'm like, well, what do you mean? She goes, well, the pressure in the hose would be too high. I said, exactly. I said, do you have problems with your vision? Well, yeah, I got to take, the doctor said I'm losing my sight. I said, do you have problems with your kidney? Yeah, baby, can you see me? I'm like, no, man, it was early in the morning. I did not want to see her. Did not want to see her in the morning. But she said that, well, nobody ever took the time to explain it to me like that before. So I explained it to her. She, can I still keep drinking my coffee? I said, well, have you ever thought about decaf? She hung up on me. But ironically, the line started lighting up. And I started getting question after question after question. And my boy, who I don't even speak to this day, because I was trying not to be a doctor, says, Dr. Griggs will be back next week with his own show. And I'm like, no, he won't. No, I'm kidding. Da-da-da. Well, that 5-minute interview turned into a 30-minute show, turned into an hour show, turned into Bayou Classic, turned into, the TV, turned into me being here. Turned into marrying the thing that I hated the most, which I hated research. You get bitten by rats, you got bitten by mice, the dogs are really cute, The cats are really cool and cute, and you got to kill them and do for the sake of something. Monkeys sling feces when you walk in. You got to go in like this, make sure their teeth. And if you don't sedate them enough, they'll grab your pants and make you pray. Yeah. So I hated research. Got involved with the clinical research. All of this put me back with the people, and it put me back with community. In 2014, Senator Heitmeyer gave me a title by Louisiana Senate resolution. They called it, they named me the Ambassador, Health and Wellness Ambassador for the state of Louisiana. And then, man, that's why I don't do this. I get nervous when I get up here because it's tough to talk about. In May of 2014, Latoya Cantrell was a councilwoman, and she made a city council proclamation naming me the Health and Wellness Ambassador for the city of New Orleans. And I was like, gee, thanks, y'all. What is it? And I had no idea, but I was proud because now I can take something home to my grandmother. She can be proud of me. My grandmother's best friend, 3 months prior, cousin Mert had passed away. My grandmother's vision was gone. Miss Grace down the street, which is like a second mom, passed away like 3 weeks after that. My grandmother would sit around and people would talk to her loud. If you have older family members, they're not deaf. So don't talk to them like they're deaf. Because she'd be like, why are all these people yelling at me? What did I do? I did something wrong. How you doing, Miss Fit? I was fine until you started hollering. But that was a Friday I got the call. She got depressed. She quit eating. She was 90. Quit eating and quit drinking. She went to the hospital on a Friday. I found out about the award on a Thursday, and I had planned to surprise her. I was supposed to go home the following week after I got the official. I had the paper because I printed it on email. She passed away Monday while I was giving a lecture at the American Cancer Society. She knew I was coming, and she didn't wait. Sorry. I went home that day to North Carolina. I made all the phone calls to quit my job, to close out whatever I was doing down here, because I wasn't ever coming back to New Orleans. I was never going to look at medicine again. I didn't care. My grandfather died thinking I was a failure. Couldn't help him. My mom, believe it or not, is back to old school mom. The evolution of the medications has her taking a shot like everyone else. I don't know why, and it's bad now. Diabetes has been a blessing for us because she was taking a shot for that, and this is just another shot that gets her through. But my grandmother died thinking I was a failure. So my mom and my uncle and my family heard me making the phone calls, and literally they had an intervention, and they were like, you didn't come all this way to leave your work. You have more work to do in the community. And did you ever think that she might have left because you found your way and she wants to be with you wherever you go? So it re-energized me, and people ask me in community medicine, they always ask, Doc, do you sleep? My answer is no. Because I constantly hear my grandmother saying, baby, you got work to do. You have work to do. In these last county rankings, Louisiana state rankings, Louisiana is number 50. I'm not going to call it a failure, but I got more work to do, a lot more work to do. And I identified, well, I won't even say I identified. I keep messing with Lamaya. This is my #1 student mentee in the back of the room. My grandmother always said you can't work while you talk and playing sports. If I'm talking, I'm going to talk till we play, especially playing football. You keep talking while that play happens if you want to. Somebody punch you in the mouth. I work a lot. So, Lamar, you can briefly, so my foundation, I'm the founder of the Griggs Foundation. One of the things I'm most proud of. We have about 30 students. It's work with us. We have a new community center, and I've been very quiet about it, that we haven't put it out there yet until we get all the kinks out. But we do a little bit of everything. I make sure the students publish. Every month in Breakthrough Media Magazine, the students write the article. I publish them, so you have stuff to send home to your mom. At Fox 8, they help me with my scripts. I'm working on getting the students on to do segments so your moms, dads can actually see you do it. But it's interprofessional education. It's public health, it's med school, it's nursing, it's undergrad, it's pharmacy. I take everybody, and it's non-school. Every second Monday, we have journal club. We normally have journal club. We've just been busy. To make change in the community, Xavier School of Public Health actually teaches the class on Tuesdays in the community, with the community, like a lab, which is amazing. Lamai, briefly, how do we meet? And I'll take questions, real brief.
We meet every Monday at the community center to discuss our programming and our future programming and which direction we're gonna go.
What are the days?
For the community center, we have Medication Monday, which is where you come and you discuss your medications that you're taking. If you have any questions or if you need help, getting on a plan to take your medications daily. We have Tasty Tuesday, Tasty $20 Tuesday, so we make a meal that can feed 10 to 15 people.
Because my sister and her old man are raising 8 kids. So that's the whole purpose of it, so you can get a feel of what needs to be done. I'm sorry.
And you use $20 to make that meal to feed 10 to 15 people. We have Walking Wednesdays where we have 2 different walks, a morning walk and an afternoon walk.
Partner with Girl Trek. Shout out Girl Trek.
Girl Trek. We walk down Little Deep Greenway all the way to Orleans and then back to the community center. We also have Thirsty Thursdays where we do education based on water, how important water is. But also
70% of the population walks around, a minimum 70% of us walk around dehydrated. So we want you to find other ways to get water in your foods to save your kidneys, your blood pressure up. Sorry.
And then we discuss like different, myths with the drinking certain things like apple cider vinegar,
Mocktails and cocktails once in a while.
and all that. So we do talk about that. Then we have Follow Fridays. That is if you have been to the doctor and you don't understand, what your doctor has told you, you can bring in your results and then discuss it with a med student or a pharmacy student.
Public
And
health
also
students are
follow
there to
the
make sure people
medication
get there.
as well.
So part of that, the whole purpose of this and the program, it's community driven, student activated, and professionally mentored. Based on my experience with my own family, based on being thrown to the community, because my grandma always telling me, I got more work to do, I need your help. Lamai was one of the ones we were working, she asked, what do you do? I said, nothing, leave me alone, stop bothering me. And she said, I'm not, and she just stuck around, and then we started inviting other students to be a part of it. We take everybody right now. And it's grown. I'm very proud of her because she was going immediately to med school, but you would be glad to hear, now she's enrolled in the School of Public Health because she wants to have a public health maintenance. That's what I try to get all of us to do. Went to Cuba, saw how functional their program is, and I think that we can do the exact same thing here. And I need help doing my work, so I don't get in trouble with my grandma. At this point, I'll take questions. Please ask questions. Get checked, get fit, get moving. Get checked came from talking in terms that people understand. If you look at all the studies, they say people remember things in 3s very readily. People practice policy. Get checked, get fit, get moving. Y'all see it? Yeah. Get checked is climb your family tree. Know your health. Get fit is food. Fitness, food is the answer. Food is your medicine. If you want to lose weight, stop eating so much food. If you want your heart to be healthy, that's when you get movement and you exercise, any type of exercise. That make sense? Mm-hmm. Okay. You had a question?
Where can you find more information about what you are doing?
Yeah, where can you find more information about what we're doing? Because I haven't publicized yet.
You were talking, so where can I go find?
So you can, I can give you my contact.
The reason why we're being so covert now is because you can't work and talk, and I want to get all the kinks out. We have a website, we have all that stuff, but I want to put it, by the time people see it, I want it to be, the Fox wants to do a story about it. There's a lot of stuff that we want to do. I haven't even reached out for partners yet. We've slowly but surely, because we want to make sure that we're willing. Right now, we have a very benevolent funder that has about $5 in his pocket to run every day. And so far, we're doing pretty well. But we'll reach out soon. Lamaya will be the point of contact. Keep going.
So you mentioned that it's an interdisciplinary thing that you're doing.
It's a what?
Interdisciplinary thing that you're
Yes.
doing. So how can community or community members, I'm a social worker, but I run a program, you know, it deals with mental health and well-being. So how can we get involved in what you're doing or support us?
1,000%. All you have to do once you make the contact, that's it, because it takes a village to solve this problem. The problem is, the reason I say that we failed, and people hate to hear it, I was just on the radio show getting beat up, but we failed. If we need to let the community dictate back to healthcare how we fix the problem, and we don't need to do it one person at a time. It needs to be a public health approach. So we can change the policy. Policy dictates funding. Funding dictates practice. The other reason that we're taking our time to open is because you can't be a part of the community is so used to one-offs. Oh, that program is great, baby. Oh, it was? Yeah, and then we went there, the door was closed. Ran out of funding. The beautiful thing about our community center is everything that you see in the building was donated, which is why the space was donated by Pastor Augustine at Greater St. James, Historic St. James AME Church, and all of the equipment, everything you see was donated. Once they found out we were doing something, the answer for the community lies in the community, and what you give them, they give back 1,000-fold if you ask them what they want. And that's what we're spending time to do. So yes, that's the way to do it. Lamaya. Other questions? I like questions. I like questions. Yes.
Can you tell us about your process of building trust with the community?
Thank you. The whole process. Community medicine is what? It's 3 Ps. It's what?
People.
The way that you build trust with the people is time. And that's why Access Health hired me as a community medicine doctor, so I can groom other folks. I don't care if you're an MD, if you have your MPH, your PhD, no D, nothing. If you're willing to learn the information, we're trying to build ourselves as a resource so you can go out and do this. So my job is to build a force to do that. You have to spend time in the community. We were there last week in the community. It's been there 50 years, normally quiet, the whole nine. And while we had the Deputy Director of Health with us, dude got shot right before the meeting. Yeah, then as the students are walking in. But the thing is, we're sitting there like, well, y'all get inside. What happened? I don't know. Don't talk to me. I don't know. To build the trust in the community, you have to understand that you're part of the community. So the first thing that we did was we did what we're going to encourage. We're letting them breathe a little bit. I don't know if you've heard of mental health first aid. Mental health first aid is a formal course that you can take that will teach you how to talk and start those discussions in the community. But we talked about it. How do you feel? What is it? Do you feel safe? The neighborhood was checking to make sure we were okay. Why? Because we spent time there. We didn't just open up and start doing programming. Y'all want to walk? Y'all want to dance? No, I don't know you. So it's the same thing. And luckily, the Deputy Director of Health was from Baltimore. He said, man, you've seen The Wire? He said, I lived it. I'm like, all right, well, you know to get inside it. So you build your trust with the community with time. The answer to being able to dictate and have a voice in the policy room is your titles. It's your education. Because if you're not sitting at the table, you're on the menu. And that's the problem. We've been on the menu. That's why they come out with terms that people don't understand. They want to put eating etouffee and crawfish in Nebraska. It's not going to work. It's not culturally relevant. So that's the answer is it's time. And if you're not comfortable in a community, either you spend enough time or you find someone from the community. That's why we want to marry the community health workers with us that can walk you in so you can spend time. Because there's one thing to spend time and it's another one to spend quality time. If people don't know you, they'll let you sit in the corner by yourself. Who is that? I don't know. You want to ask them to leave? I don't know. Just let them sit there. He'll be all right. You want some water or something? All right, let them go. Make sense? The problem is, now the one thing my grandmother said when I got on the radio, and she said, you're saying some radical stuff. She was actually somewhat proud, a little proud. She said, I don't want you on there acting like no fool, laughing and giggling. And understand you're saying something that's different. If the answer is in the community and in prevention, and everybody's worried about treating, in dealing with sick people. Sick is not a disease state. Sick is a state of mind. Because I know people with the same disease. This is a hero right here. She's a celebrity for lupus. And you wouldn't know, they're beautiful, and she's positive all the time. She's not sick. I'm a community medicine doctor. I deal with healthy people. I let the people in offices deal with the sick people. That's not my thing. But my grandmother said, and if you don't remember anything else that I said, if you're going to do something disruptive and innovative, and you've done your research and you stand hard on your laurels, first they're going to call you crazy. Then they're going to laugh at you. Then they're going to question you. And if you stick to it long enough, they'll follow you. Then hopefully, they'll fund you. I think my work here is done. She got the message. Any other questions? No? I'll be right here. Yeah, we go into barbershops. It's as simple as everyone can use a blood pressure cuff, a scale, and a waist circumference. We do challenges with that. Teaching someone how to properly use it, if you know how to use it, you don't have to have a license. You don't have to be a doctor to do that. Take the time to listen. Make sense? Sound easy? All right, thank you. Thank you.
Please, if you have not gotten something to eat, there's lots of food over here, so please do get something. And Dr. Griggs will be around for a little while to answer any further questions. And please also fill out the evaluation. If you did not get one, there's some out on the table out front, and make sure you signed in as well.
So another quick pearl, if you're ever asked to speak to people, I want you to remember it's the rule of ease, right? And it's not because my name's Eric. You want to engage your audience. You want to excite your audience. You want to empower your audience. And Lamaya, what's the last thing you want to do? You want to finish early, so they'll ask you back. You don't talk too much, you never get back, right?